Zara.
Hi there.
Hi. Can you hear me?
Yes, I can. You just
Okay.
video seems to be working.
Okay, so I'm supposed to be sharing a screen. Okay. Only 4 participants. So what's going on now? What is that doing now? Zara? Zara? My goodness.
Hi, everybody. How are you all doing?
Good.
Good. How are you?
Good. Thank you very much. I'm so excited for this presentation today.
Jeremy's on
mute. Yeah.
Okay, unmute, yeah. So hi, Jeremy. Jeremy.
Hello, Jeremy.
Hi.
How are you?
I'm well. How are you?
Good. I'm just sorting out my settings here.
I'm so nervous. Okay. So now.
Good.
Only 6 participants. So now it's
All right.
same.
Hello,
I think
Zara.
we'll also have to enable participant screen sharing so that we can share later. Because I think as it is, we cannot share our screens.
Okay, Dumi, can you do that?
But it says your screen sharing, yeah. No share. Okay, share. Any changes?
Yep. No.
Still
disabled.
Maybe
Excuse
you
me?
need to stop sharing first. I think you're still sharing. Maybe stop and then see if you can see
Okay.
the options. Because there should be.
Okay, now I'm gonna share again.
No, you'll actually need to, next to the screen sharing button, there should be the little arrow. And then if you click on that, it should give you the option to allow participant screen sharing, because then we can also share our slides later.
Yeah.
Okay.
Can you see that little arrow button?
Hold on. Share screen.
Can do.
I can see share screen. What else should I be seeing now? So now, because now I'm looking at these instructions here.
Well, there should be like a little arrow thingy right next to the share screen button, or like on the top right corner, I think, of the share screen.
Okay,
Yes.
I got it.
And then there should be like a little
multiple participants, yeah. Okay, I got that one. So any changes your side?
Yes, now we can share. Cool.
Brilliant. Okay, so
Oh, fabulous.
Lena,
Great.
I'm up
Okay.
first, right?
Yes, yes, yes.
And then you'll take over, then I'll come back.
Yeah, I think that, yeah, sounds like a good plan.
Awesome.
Okay.
Great.
I'm sure you don't see
Fabulous.
me, right? You don't see me.
Mm-mm.
No, we can't see you, do we?
Okay, I'm gonna for you to see me, and then I'm gonna go.
Oh, very exciting. Will we recognize her?
How? Where do I do this now? Come on.
Can say-
Oh no. Where do? Oh, there. Okay, can you
Hi,
see me?
Dewey.
Hi.
Hello, do.
I still look the same. Hi.
You do, yes. You're definitely yourself. You're not an imposter.
Some little bit
Important
of
we
fair though.
verify. And how's everyone at home doing?
Oh,
How's
everyone
Elvis?
is fine. Yeah,
Yep.
everyone
And the
is fine.
children? The
Yes,
children?
everyone is fine.
Yeah.
Yes.
Have they gone back to school?
Yeah, Bobo's gone to school. The little one is not back yet.
Of course not. Right.
Thomas.
Yep.
Yeah.
So where's Thomas now?
Oh, with my sister.
Okay.
I went to drop him there, my sister. Otherwise, he was going to be chaos.
He wanted to join the presentation.
Yeah, but I'm all alone now, so it's okay.
Okay. So
All right.
is Elvis working?
Yes,
Yeah.
he's working every
Excellent.
day.
Great.
Yeah.
Okay. I'm going to try and
All
share my screen.
Super.
Okay, I'm gonna switch my face off, eh?
Yeah.
Okay, great.
Okay. Have I shared my screen?
Yes, yes, yes.
Okay,
Brilliant.
great.
Whoop.
Only 9 participants on.
Okay. But I don't. Whoop. There we go. Do we have any other participants yet?
We got 11.
Okay.
7 participants.
Cool.
Why?
Should we start to admit them? Are we feeling okay? Are we feeling set?
Yep. I'm happy. Lena?
Okay, great.
Yep. All
Perfect.
good.
Thank you.
So I can invite them.
Yes,
What
you
time
can.
is it?
Thank you.
Okay. Oh, no. All right, admit all.
We're waiting for everyone to be admitted. Do me, will you tell us what everybody is in?
Okay. I've allowed them, all of them though, that are here, 12 of them.
Fine. I think we should start. If everyone's happy with that. Welcome to it's actually the second CSSR webinar of the semester. I'm assuming there is people listening out there. This is the second webinar. We do have 2 more webinars lined up. I can't remember the exact dates, but one is in about a month and the other one is a little bit later. One is Nonzuzo Mbakazi. I know Nonzuzo is here today, but Nonzuzo has just been awarded her PhD on the childcare options of working mothers in urban and rural areas in KwaZulu, supervised by Lena and myself. And she'll be presenting one of the chapters of her thesis. And then the other webinar, which is lined up is Hangala Siachuena. And most of you will know Hangala. Hangala has just submitted a revised thesis, which looks at the impact of changes of government on policy reform in Zambia and Malawi, with particular attention to social protection policy, which is what we're also talking about today. So today, Lena and I are going to be presenting. Lena is a PhD student in sociology, and she will be presenting the work that she's been doing over the last couple of months, very extensive work on mapping social protection responses in Africa. I'm going to say a few things up front, and then after Lena has presented, I'm going to come back. So I'm going to talk very briefly about the challenge facing Southern African countries in aftermath of COVID, or in the midst of COVID. And very briefly, I'll talk about international organizations and their response. Then the middle part, which will be the largest part, will be Lena talking about the variety of social protection responses in Southern Africa. Then I'm going to come back and talk a bit about how social protection systems in Southern Africa have evolved in the past, and how different social protection systems in 3 countries have adapted in the present, looking at the continuities between the past and the present. So we should take, Lena and I, about half an hour, and then we'll have half an hour for discussion. So first up, so I apologize, I do have quite detailed slides here. Of course, I think we all know that the challenge of COVID-19 in Africa is primarily an economic one, not primarily a public health one, but the outside of South Africa and parts of North Africa, there are very, very few confirmed cases. And of course, that might be a product of very little testing, but there's also very few deaths attributed to COVID. So if you look at the generally accepted international data, between the Limpopo and the Sahara, there's less than 9,000 COVID-related deaths have been recorded. Even if that's an underestimate, it's still obviously a much smaller number than many other parts of the world. But the economic impact is enormous. We don't know exactly how enormous it is yet, but the forecasts are pretty dire. It's very likely that the African economy as a whole would contract by 3% this year. It's the first recession in a generation. Real GDP per capita will revert to its level in 2007. In other words, all of the benefits of growth since 2007 will have been wiped out. Recovery next year is likely to be very slow, especially in Southern Africa, and slower than the rate of population growth. The IMF's most recent forecasts earlier this month, that South Africa's economy will contract by 8% this year, Botswana's by 10%, which is a completely unprecedented contraction in Botswana since independence, and Zambia slightly less by 5%. Those are the 3 cases that I'll be talking about later. And the effects are likely to linger. GDP per capita is unlikely to, or is predicted to recover to its 2018 level only in 2023 in Botswana, 2024 in South Africa, and 2025 in Zambia. Sorry, way after 2025 in Zambia. Zambian economy is in a real mess, and COVID has pushed it further. So the impact is essentially economic, not public health, but it's serious, major economic impact, unprecedented in recent years. Now, international organizations have in the last 20 years played a really important part in shaping the agenda of poverty reduction policy across the whole region. And when we study social protection policy in particular, we can see that international organizations have played a really crucial role. And they do this in a variety of ways. They promote reform through their publications and research and so on. They provide technical assistance, and they fund programs. So the most recent estimate from the World Bank that I've seen, Lena might have a more recent figure, but the most recent figure I've seen from the World Bank was that in 2019, donor funds financed on average 55% of program spending across Africa on social safety nets. Now, international organizations try and coordinate, and they do coordinate to some extent. And I point in the slide to the 2016 so-called Global Partnership for Universal Social Protection, when all of the agencies said, oh, we're all in favor of universal social protection, and they coordinate through this strange body called SPIAC-B, which is a coordinating body. But international organizations actually differ quite substantially in what they think social protection should be doing. They have different approaches, different goals and priorities, and different preferred models. So although that they all say they're in favor of social protection, what they actually favor differs quite a lot from one organization to another. And we'll see that that has an impact now. So how have the international organizations responded to COVID? Well, very early on in March, the UN agencies all put out a joint appeal for funding under the rubric of the Global Humanitarian Response Plan. Initially, they said we need $2 billion, and by July that had gone up to $10 billion, of which $4 billion would be earmarked for African countries, some for health, but mostly for non-health needs. Now, $10 billion might sound like quite a lot, but it's not really. If you think it's less than South Africa has already spent on COVID responses in different forms, health and non-health. There was an appeal for funds. There was a great deal of emphasis on things need to be done, and what some of the things that need to be done are social protection reforms. SPIAC-B, the coordinating body, put out statements saying we need more social protection. The individual international organizations all put out statements saying we need more social protection. There's been lots of data collection by various organizations. Right? What has actually been done is much less clear. And I think Lena will speak a little bit more to this. I think it's fair to say that the enthusiasm and the emphasis that the international organizations brought in March, April, May hasn't been converted into very rapid rollout for the most part. Right? We don't exactly know, which is why Lena's work is so important, because the international organizations themselves haven't really got very far in reporting on what they've been doing. They're just really beginning to produce reports now on rollout. So now I'm going to hand over to Lena, and Lena can tell us what's actually happening. I'm going to unshare my screen, and Lena is going to share hers.
All right, just share here quickly. Here we go. All right, can you see my screen? Looking good? Okay, great. So my part of the presentation will really look at what has been done, or what we know about what has been done thus far in terms of the social protection response. And it's based on one of those mapping projects that Jeremy just mentioned. It's the one done by the International Policy Center for Inclusive Growth. And it's basically a very extensive, or intended to be very extensive, mapping of the responses in the Global South. So it's mapping Latin America, Asia Pacific, and Africa. And I was the person responsible for the Sub-Saharan Africa mapping. And the focus is really on government responses. So it doesn't include humanitarian or entirely humanitarian run programs. And among other things, we mapped coverage, adequacy, timeliness, linkages with existing programs, delivery. So it's quite a bit more extensive than what the World Bank has been doing. But again, data is not quite where we would like it to be. It was based on a review of mostly publicly available information, so lots of media coverage, government press releases, and so on in different languages. And overall, it covers the period from when the responses started, so in March until end of September, but it is still ongoing. So we are still completing the mapping. And and the outcome will basically be a dashboard of those responses that will be published on socialprotection.org in December. So hopefully by then we will also have a little bit of a more complete picture. But nevertheless, we do have some preliminary results. So this is as of end of September. As you can see, Sub-Saharan Africa in green. So this shows the number of responses per country. So obviously darker countries means more different responses per country. In total, we had 155 in 43 countries. So most countries had some form of social protection response. But once again, this doesn't say much about the coverage or the reach of those programs, just the variety of responses that we have recorded. And overall, quite unsurprisingly, I think Sub-Saharan Africa really has a massive focus on social assistance. So your in-kind transfers, cash transfers, subsidies, a little bit of labor market interventions, mostly employment protection schemes like the South African TERS scheme, for example, and a tiny little bit of social insurance, which to an extent mirrors what we saw pre-COVID, so also large focus on social assistance in the region. And that's just a bit of a more detailed overview per country. So just once again, number of responses in the bar chart. And as you can see, everything in blue is social assistance. So really very, very clear a focus on those kinds of interventions. And and just zooming in, so those are the countries that Jeremy will take a closer look at later. South Africa kind of among the top runners in terms of number of responses, whereas Botswana and Zambia are really more towards the end with only 2 or 3 different responses there. Now, if we look at the different instruments that were used within those categories, so looking at social assistance, as you can see in the bar chart, the largest part or largest share of responses were actually subsidies. I'll talk a little bit more about that later. But then the second largest part were emergency cash and in-kind transfers. So you can see cash in gray, in-kind in orange, and those were really kind of new interventions. So in some cases, a little bit based on existing databases, but more than just expansions of existing programs. And those expansions of existing programs, you can see in the green and the blue part. So those are really kind of top ups or horizontal expansions, coverage expansions of existing cash transfer programs in those cases. And then, if we look at the labor market interventions, as I said, much lower in terms of the numbers, but mostly wage subsidies, basically, government giving money to companies in exchange for them not retrenching workers. So that was really the key kind of labor market intervention that we saw in Sub-Saharan Africa. Then the next thing I want to zoom into a little bit is changes in coverage. So really expanding coverage of programs to new beneficiaries, new beneficiary groups. And the graph on the left shows the emergency cash transfer programs that were introduced. And those are the 5 largest ones in terms of coverage of total population. So as you can see, Namibia actually managed to reach almost 1/3 of the population with the emergency income grant. And then South Africa up next with the social relief of distress grant. And that obviously being a much longer program. So even though it reaches less in terms of share of the population, it is a much longer program. And also in terms of the individuals reached, the number is actually much higher than in Namibia, for example. Togo, Madagascar also had emergency cash transfers, mostly more or less short-term, 2 to 3 months. Malawi did announce quite a large program, but it was never implemented due to many reasons, among other coordination and funding issues. So hence it is included, but in brackets. And then on the right, you see the same for in-kind transfers, so mostly food, in some cases also hygiene products. And I think what stands out is that the coverage, at least in terms of percentage of population, looks much higher. As you can see, Botswana here managed to reach more than half of the population with food transfers. But what must be noted is that that's also because most of those programs distribute to households, not to individuals. So one food parcel reaches between 3 and 8 people, depending on the country. So obviously in terms of numbers, you will have a much higher coverage compared to cash transfers. Some of the countries, the ones in bracket, for those we only have data based on announcement or targets, so we don't have the actual data yet. Hence, those also have to be taken with a pinch of salt. Hopefully, we will have more detailed data here in the next few weeks or months. And yeah, one of the things that we also noticed was that there's really a focus on urban areas, partly because many of the lockdowns were implemented in urban centers or around the capital. So obviously the focus of those mitigation measures was also in those areas. And yeah, in some cases also door-to-door distribution to avoid crowding and comply with lockdown regulations, also one of the features that, that we've seen here. Okay, and then the other approach to expanding coverage was expanding existing programs. And this graph now looks specifically at cash transfers, so not food. And what you see on the left are basically the initial coverage as percentage of total population in blue, and then the announced expansion in orange. And as you can see, Zambia should have one of the highest coverages in terms of share of population after that planned expansion. And quite a few countries have announced those programs. They're not all mapped on the left because some of them have a very low coverage even after expansions, or below 1%. So those are just the largest ones. And yeah, most of those expansions target, are they poverty targeted? So not really your categorical, your pensions, disability grants, child grants, but more poverty targeted at vulnerable households, informal workers. But most of those are actually long-term expansions. So we've seen very little in terms of rollout here. The announcements are there, Zambia being one of the examples. 2 payments have been made there, but we're not really sure how much of the percentage they really cover. And yeah, in many of those countries, there are quite significant delays. There's negotiations with donors, funding, new beneficiaries must be registered. So we might see more in terms of implementation here in the next few months, but for now, most of this data is really based on announcements at this point. Okay, and then, yeah, as I said earlier, subsidies were one of the key instruments used in sub-Saharan Africa for the social protection response. We mapped a total of 50 different ones in 33 countries, so really quite widespread. And one of the key subsidies used here were utility subsidies, so water, electricity. As you can see on the map, mostly West Africa, a little bit Central Africa, and we had a total of 19 countries using that. And the way it was applied, it was basically an automatic discount given to low volume users or users of social tariffs in those countries. So if we were using less than a certain amount of water, electricity in the previous month, you were given a, depending on the country, 20 to 100% discount on your water and electricity bill. And another one we saw was mobile money interventions. So also 19 countries implemented those. Again, West Africa quite prominent because there was a decree by the West African Bank to relax mobile money regulations to encourage digital transfers, avoid crowding, avoid cash usage, and so on. And also in East Africa, because obviously mobile money is quite prominent there. And yeah, some of the measures were just waiving fees on mobile transactions, making it easier to open accounts, or raising daily transaction limits. Again, those were also usually implemented for about a month to 3 months. So also a temporary measure, really. But yeah, in the countries that we will look at, that wasn't really one of the prominent measures. As we'll see later, other instruments were used there. So that was really more of a West African and a bit more in East Africa response. Okay, and then the last thing I want to zoom into is the use of digital tools, both for enrollment and registration and for payment, because that's really been one of the kind of distinguishing features of the social protection response here. So as we know, in sub-Saharan Africa more generally, social registries aren't very widespread, and even existing databases are often not necessarily updated or complete. So to reach out to informal workers, unemployed individuals, people not captured by existing systems, you can't usually rely on existing data. So we mapped a total of 32 new enrollment campaigns, and that's across all interventions. So that's cash, food, wage subsidies, and so on. And as you can see, even though quite a few still used in-person registration, more than half actually used either mobile platforms, websites, emails, and so on. And many of the campaigns that did in-person enrollment used an additional mobile or digital approach. So this is really something quite new, because traditionally enrolling for social insurance or for social protection means standing in a queue, filling in a paper form, waiting for days. So this is really quite something new that we've seen. And yeah, on the right, just a few examples of the countries that have used those approaches. And I think the most innovative one really being use of mobile phones. So the USSD SMS kind of portals, we saw it in Namibia, Togo, South Africa has also made use of that, even the use of WhatsApp for communication and so on. So that's kind of quite a new feature in terms of registration. And then if we look at the payment side of things, that trend is even more pronounced in terms of using digital channels here. So this is just looking at the emergency cash transfers, the new cash transfers implemented as part of the COVID response. And you can see that, yeah, more than half of them actually used mobile money, which is quite a big departure from previous existing programs. There has been a trend towards mobile money, but most of the larger programs hadn't adopted it at scale. There were pilots, there were small initiatives, but rollout had been slow. So now for the COVID response, the new programs that had to be implemented quickly, most of them actually used either mobile money or bank transfer, and just a few still relied on cash, or I think in 2 cases there were check payments. And yeah, again, just a few examples of which countries used what. And in terms of the existing programs, so existing cash transfers that changed their payment modalities during COVID, not many of them did, because many relied on new interventions. But some programs actually accelerated the use of mobile money. For example, Lesotho, Eswatini, Nigeria, and Malawi, as part of their COVID response, they really pushed to move more towards digital payments in order to, avoid crowding queues and so on and so forth. So, of course, what will be the interesting part is to see to what extent that will translate into existing programs. We've seen a few small examples, like South Africa now launching digital enrollments for the regular social grant programs. But the really interesting part, I think we will see in a few months or maybe next year, to what extent this kind of COVID boost will actually be sustained beyond the emergency response. And yeah, that's just before I hand back to Jeremy. Just again, a quick overview of the countries that he will take a bit of a closer look at. Again, South Africa, kind of a relatively broad response, but focusing on cash and food, a little bit of employment. Zambia did announce that cash transfer here, had a mobile money response. Botswana, mostly food and wage subsidies. And I did add Tanzania because it's one of the kind of no response examples almost, where there was very, very little in terms of a specific COVID response. But yeah, Jeremy will tell us more about that. So let me stop sharing and hand back to you.
Thank you, Lena. So yeah, I think what's very clear from Lena's presentation, I'm trying to look for my slides. Here we go. There we go. What's very clear from Lena's presentation is that there's been enormous technological change, or considerable technological change in sort of registration, implementation systems, how beneficiaries are registered, how payments are affected, and so on. And there's been lots of talk of new programs, Now, really the question is, how much has actually happened, right? And I'm going to talk take 3 case studies: South Africa, Botswana, and Zambia. I was going to talk about Tanzania as well, but I ran out of time. Sorry about that. My apologies to any Tanzanians. But Tanzania is like an extreme version of Zambia. But if we take the 3 cases I'm going to be looking at, South Africa, Botswana, and Zambia, we can see that there's a very wide range of responses in practice as to what is actually happening on the ground. And I'm going to suggest that this variation in what's actually happened on the ground, right, reflects really continuities from the pre-COVID systems of social protection. Now, very quickly, I want to summarize the kind of work that many of you have heard before, really on the way in which social protection systems in Africa developed over the last 50, 60 years. And then I want to focus on the 3 case studies to show how 3 different systems in Southern Africa have adapted in the last 6 months. So very, very quickly, African welfare states, African social protection systems have developed historically along very different trajectories or very different routes to the classic welfare states that are well documented in the European case. So in the European case, welfare states either developed with a focus on incorporating pesky urban and industrial workers. For example, in Germany, we have a picture there of police and pesky workers in Bismarck's Germany in the late 19th century, or the British and the Scandinavian route, which was primarily to pay attention to poor people through social assistance, and whichever route European countries started off, they tended to there was a degree of convergence in the 20th century, especially the second half of the 20th century, in providing through both mechanisms, social assistance and social insurance. Now, in the African context and in South Asia as well, public provision developed really along very different lines. Really, there, workers, for the most part, urban industrial workers, were not nearly as important as they had been in Europe. But the really pressing problem was not pesky workers, but was rural peasant farmers, and the real risk was drought. So welfare regimes developed primarily in most of Africa and South Asia in response to protecting people against the risks of drought. Right? So the question there was not whether you provide for the poor or for workers, but whether you provide for the poor or peasant farmers. So I've got several slides here that I'm going to just skip over in the interest of speed. Sorry, if I can. Here we go. Let me skip them. Okay, so historically, this graph really tries to show, many of you have seen it before, it tries to show how countries in the global south have expanded their welfare regimes really around the turn of the millennium. And they could either do so by expanding social assistance, which was a pro-poor measure, or by social insurance, which was a pro-worker measure. So Latin American welfare regimes primarily expanded provision for workers, African and South Asian, much less so, primarily for poor people, and then, as I said before, for peasants, because peasants provide a kind of a third dimension in Africa and South Asia, which doesn't exist in the same way in much of Latin America or in Europe. So in the African case, the real variation in how welfare regimes are developed is along the vertical axis on this slide and the axis that's going into the screen away from us, and not the axis going down towards protecting workers. So the three routes we have in Southern Africa, or Africa as a whole, settler societies such as South Africa tended to develop their welfare regimes to protect poor people primarily. In the South African case, because effectively there were no peasants. Peasants were destroyed, the peasantry was destroyed, and South Africa's social assistance programs, old age pensions, disability grants, and child support provision really developed primarily around a sort of a pro-poor dynamic. They were not aimed primarily at working people, right, or farmers, right. So that's the first route. Second route, which Botswana exemplifies, it's a country where the peasantry was struggling from very early on in Botswana because it's inhospitable climate for farming, and with regular and protracted drought. But the peasantry has historically always struggled. And so that in Botswana, from the 1960s onwards, the welfare provision combined sort of elements of pro-farmer support and elements of pro-poor support, recognizing that more and more poor people were no longer farmers. Whereas in most of Africa, certainly through the late 20th century, provision was focused on small farmers, not on the poor per se, right? And Zambia, well, Tanzania would be examples of that. So we've got these different trajectories, and they resulted in very different welfare regimes pre-COVID. So the settler societies, South Africa, Namibia, for example, have these well-institutionalized welfare programs, extensive coverage, considerable expenditure. Botswana institutionalized drought relief, which evolved over time into permanent welfare programs, but as we'll see, quite parsimonious, quite conservative, whereas most of Africa was very slow to shift from drought relief into permanent welfare programs. So how is this reflected in our three case studies? Well, if we look at South Africa, first, as we know, South Africa has by far and away the most extensive set of social protection programs in Africa, through both school feeding schemes, 10 million children, grants to 18 million grants paid out every month, some workfare, cost in comparative terms very high at more than 3% of GDP. And then of course there's also labour market interventions, wage regulation for workers and so on. Right? But it's a highly developed social assistance system which is particularly important in this African case. So what happens with COVID? Well, the first thing is a massive expansion of unemployment insurance through the UIF TER scheme. It's what Lena was referring to as a wage subsidy. Whether it's a wage subsidy or unemployment insurance is a moot point, because of course most of the payments are going to people who are now unemployed, who did not qualify under previous systems. Right? And this has been a huge disbursement. It's been extended now. We think it's been extended to the middle of November. Whether it'll be extended further, we don't know. But the extra cost is going to be clearly well over 1% of GDP. Secondly, the government supplemented existing social grants, and it's very unclear whether that will be extended beyond the end of October now. It was initially for 6 months, and that's also quite a considerable cost, 0.6% of GDP. Right? And as Lena mentioned, they introduced the emergency grant, the so-called COVID-19 Social Relief of Distress grant, which is relatively modest, 350 Rand a month. It was very slowly rolled out, so it didn't really get paid much until June, July, so it missed out at the very beginning. But the numbers did creep up. It's now being paid to more or less 5 million people, and it's going to continue to be paid until January of next year. But so the cost is about 0.3% of GDP. So South Africa has had a well-developed, extensive, and relatively expensive social assistance system, and it has extended it quite dramatically to another 7 or 8 million people at the total cost of another 2% of GDP. So it's quite substantial. There are two caveats we need to note. The first is that work workfare has been rolled back. It's very difficult to find out precisely how much, but that's a relatively minor effect. The big caveat is that the school feeding scheme was shut down for a long period of time until Equal Education, NGO, and Section 27 took the government to court in whenever it was, July, and the courts ordered the government to resume the school feeding scheme. Right, so there was some rollback of social programs as well as an expansion, and as I've written about extensively elsewhere, the food parcels which were distributed under lockdown, and considering the need, there weren't very many of them, were mostly distributed by civil society, not by, and very, very few by national government. But in summary, South Africa had a big system and expanded it in general on quite a large scale. So it looks like, an example really of path dependency, that if you have a big system, you're more likely to expand it dramatically. Botswana has what we've called in series of work, a conservative welfare regime, which is quite extensive, but has very conservative features. So the first conservative feature is an emphasis on food rather than cash. So yes, a very large part of the majority of the population in Botswana gets food aid, even in non-drought years. The cash programs that exist, like the old age pension, for example, pays very modest benefits. Old age pension in Botswana is less than 1/3 of the value of the old age pension in South Africa, even though GDP per capita in Botswana is now higher than South Africa. And they have an extremely parsimonious provision for what Botswana still in colonial language calls destitutes. And there's a strong emphasis on workfare. But this was still, by African standards, quite an extensive system of support, cost about 2% of GDP before COVID, compared to 3% in South Africa. What has Botswana did? Well, as Lena said, they massively rolled out food parcels. And that's the primary thing they did. They also rolled out wage subsidies, unemployment insurance to urban workers in a way not dissimilar to South Africa. Like South Africa, there was also a caveat that workfare was cut back. So overall, Botswana probably spent about 0.5% of GDP net more than it was before. So this is a sort of a medium-sized system pre-COVID, which had a medium-sized expansion along fairly historical pre-existing lines with COVID. Finally, Zambia. Well, Zambia is an example of a country which was very slow to develop cash transfer social protection programs. Hangala has documented this extensively. He'll be talking a bit more about this. Well, maybe he will in his next webinar in our series. That by last year, the cash transfer program, which is really donor driven, had been rolled out in principle to 500,000 or 600,000 households countrywide. But the government wasn't actually paying out the benefits. I don't know exactly what the position is now, but when we were in Zambia at the end of last year, at the beginning of this year, the payments were well over a year behind because of the fiscal crisis facing the government. So the cash transfer system is not nearly as extensive as it appears on paper, right? But Zambia still provides massive support for small farmers through farm subsidies, through fertilizer subsidies, etc. And the budget for this is, of course, many times the budget for cash transfers. So this is still an agrarian welfare system where support for the poor is primarily directed through farming activities rather than cash transfers. What has Zambia done? Well, Zambia has an extraordinary fiscal crisis. The government has no money, and they all of the expansion of cash transfers in practice has been funded by donors on a very small scale. So as Lena said, they've announced a big expansion, but actually very little has been done. The most recent data we can see is that the World Food Programme has rolled out an emergency cash transfer to 20,000 households in urban areas. So it's a tiny number of beneficiaries, really. Very recently, at the end of September, the government announced its new budget for the next year. They say they're going to put more money into cash transfers. They also say they're going to put a lot more money into farmer subsidies, right? And they're much more likely to deliver on that than they are on the cash transfers. So now we'd expect that the Zambian government, insofar as it spends money on anything, it's going to be spending it on farm subsidies, right? We can talk a little bit about explaining why we have this path dependency. If it comes up in questions and answers, I think we should stop there, right? The bottom line is insofar as there is variation, and there's considerable variation in social protection responses, it appears to be along pre-COVID lines, right? So I'm going to stop that presentation there, and we can open for questions. We can have questions in two forms. You can either ask a question or you can raise your hand. And I don't see I don't actually have access to either of those.
I think you need to open the participant list, and then as a participant you see the raised hand option, and then we will see once somebody raises their hand, hopefully.
I've got it. So Lena, do you want to add anything to what I said?
No, I think not at this point. I mean, I think, yeah, what we're seeing in at least those countries that we've looked at is, as you said, I mean, it's very strongly related to what was there pre-COVID, and the COVID response kind of does progress along those lines. And even if we include Tanzania, it's also kind of a similar picture where the government itself wasn't really doing too much. It was very donor driven. And in terms of the COVID response, there hasn't really been much at all. But yeah, no, I think let's open the floor for questions rather.
So I'm keeping an eye out here if anyone's got any questions. Tanzania is an example of the country in Africa which is probably most prominent for having the most chronic opposition to cash transfers, social protection. I mean, the government, successive governments have been very strongly opposed to cash transfer programs. There is quite a large cash transfer program, but it's almost entirely funded and operated by the World Bank. The government has been very resistant. And interestingly, if we look at public opinion data, for example, from Afrobarometer, one thing that's very clear is that by and large Tanzanian public share their government's preference for work-related ways of addressing poverty, not cash transfers. Afrobarometer data suggests there's quite a sort of widespread antipathy to cash transfers in Tanzania. Any questions or comments?
Sorry, can you hear me?
Yep.
Yeah, sorry, I'm not Stephanie, I'm Armando Barrientos. We have a joint.
Hello, Armando.
We have a joint lunch here. Thank you very much for the presentations, and I really look forward to reading the papers. My question is really that I can see that we have two crises. We have the health crisis, and we have the impact of the kind of economic crisis that is unfolding at the same time. And I wonder how helpful it is to put them together, because in fact, they are quite different in terms of not only the effects, but in terms of social protection interventions. I mean, if you look at the health crisis, and you know, I learned a lot about African countries, but the point is to keep people at home and to stop kind of economic activity and social activity to reduce the spread of infection. That is very different from the economic crisis, where we really want people to go out to work and produce and recover GDP and become engaged. So it seems to me that there are two very different animals here. And I'm not sure whether that is the case in Africa, because of the difficulties with self-distancing and the impossibility of lockdown in certain types of contexts. Thank you.
Lena? Well, Amanda, thank you very much for joining us, and thanks for the comment. So whilst Lena is thinking about how she's going to answer, I mean, I don't have a good sense of just how much unrecorded COVID there is in urban areas across the rest of Africa. I mean, we know that the number of confirmed cases is very low by and large, but we don't know how many unconfirmed cases, how many cases are not recorded because they're not tested, and we don't know how, and we don't know how good. I don't know how good the data on deaths are, right? But even if we accept, as in South Africa, that the deaths from COVID are much higher than the official numbers for deaths, and the data on excess deaths and suggests that that is the case in South Africa, right? Even if we accept the excess death figures, then clearly COVID has not run riot in Africa in the same way as it has in, most obviously, in Latin America or India or especially Europe and North America. So I think we can be pretty confident that COVID has not yet, for the most part, had resulted in a public health disaster in the African context, right? But what it has very clearly had an absolutely enormous economic impact, and perhaps the point we really need to make here, in urban areas, of course, and so this is a challenge for social provision and social protection in urban areas, where the economic impact, as well as, if there is going to be one, the public health impact is greatest. Right? Now, in most of Africa, social protection systems have developed primarily with rural areas in mind, because they've really, for the most part, evolved out of drought relief programs, right? And for the most part, African governments haven't used social protection programs as a way of addressing urban challenges, right? But that is now changing. So the interventions we're seeing now are unprecedented in that they have an urban focus for the most part, right? So, yeah.
I think you've actually summarized it. But yeah, as you said, I mean, there has definitely been this urban focus in terms of the immediate emergency response. Obviously now, as we're moving kind of out of the emergency stage, or possibly moving out of the emergency stage and more into the long-term recovery phase, I mean, as countries are releasing their economic programs and whatnot, I mean, that might obviously shift again, and also possibly away from emergency cash transfers, emergency food, to other interventions, but we'll see that. But just also, because I see there are two questions in the chat. I don't know if you've seen them. So we have, can you see them? Okay, yeah, because maybe we should also address those quickly before we run out of time. So yes, we have Pikani asking, between all of the social interventions in sub-Saharan Africa, which are actually more effective in terms of lifting people out of poverty or keeping people afloat. I think this one was addressed to you.
Okay, well, good. So Bakani has asked, yeah, what kind of interventions are most effective? And the short answer is, in the African context, is that in most of Africa, social protection interventions do not really keep people out of poverty. They keep people alive, but for the most part, they don't really raise them out of poverty. And food distribution has historically and today still is a very cost-effective way of keeping people alive, but it doesn't really do much more than that. We know that lots of African countries actually have very good capacity and infrastructure for distributing food. I mean, Botswana is an extreme case. I mean, Botswana has got so much experience in drought relief that it can distribute very large quantities of food relief across the whole country to poor households very quickly, which is exactly what it did faced with COVID. Extraordinarily rapid and almost universal food distribution. Right? But that's really pretty minimal in terms of people's welfare. It really doesn't get you very far. Cash transfer systems, for the most part, are just simply not widespread enough to really reduce poverty. And the cash transfer initiatives that we've seen in the last 6 months are in practice are nowhere near enough to address the worsening of poverty that is resulting from the economic slowdown. I mean, we're talking about economic contraction, as I said, of 10% in Botswana, completely unprecedented, right? And if the economy contracts by 10% and the government is increasing its expenditure by 0.5%, right, then you can be pretty sure that poverty is going up substantially. There's a very big gap which is not being filled. Do you want to add to that, Lena?
Yeah, maybe also just, yeah, if we look at the time frame of those interventions, I mean, most of them really were short-term interventions of 1 to 3 months. Some of them were specifically tied to lockdowns, so measures would remain in place while the lockdown was in place, for example, or even some of the bigger cash transfer programs, like, I mean, Namibia, it was a once-off. Togo was a 2 to 3 months. Madagascar was 2 to 3 months. I mean, South Africa is really the one country that has now kind of rolled out a longer program in terms of its cash transfer. A few other countries have expanded social security measures. I believe Mauritius has also been gradually extending what they've been doing, but I mean, that's also a very small scale. And then Mauritius isn't really one of the extreme poverty countries that we're looking at. So yeah, so I mean, that's the one part, with South Africa really being one of the few countries rolling things into next year, and even what happens after that, I mean, we don't know, because most of the measures have been, very much time bound thus far, and it still remains to be seen, as we said earlier, whether those long-term expansions that have been announced will actually be implemented, both in terms of will the funding be there, will government do its part, as we're seeing in Zambia. So those are really the bigger questions, like how sustainable will the overall response actually be, and what kind of fundamental changes will we see or won't we see?
So the second question in the chat box is from Anthony Butler. Hi, Anthony. Anthony asks, is path dependency, in inverted commas, the right way of understanding these interventions? Wasn't the key factor the time constraints under which governments were acting, which meant using current instruments, whatever? Absolutely. So, with path dependency, the real challenge is to figure out that, if policies are path dependent, why? What are the mechanisms by which path dependency works, right? And it works in part simply because officials, when they're, and anyone else, when they're thinking about how to respond to a crisis or an emergency, tend to think in terms of the menu which is already on the table. And if the menu says these are the kinds of things we can do, then officials tend to think, well, let's do more of those things. Let's do more of the things that we've done before, right? And maybe adapt it. And of course, if you had to do something fast, that makes a lot of sense. So in a South African case, that in principle, using the unemployment insurance fund, the UIF system, should have allowed for a rapid rollout of the UIF TERS program, and paying supplements to existing grants was the easiest way of rolling out extra money to poor households, right? So those were time constrained adjustments. Right, the new emergency SRD, social relief of distress grant, was more innovative, and of course it took much longer to roll out, although the SASA and the Department of Social Development made a pretty serious balls up of that, and they should have done it much faster than they actually did. But that was a more innovative measure, which was harder to do. Right? But so I think some of the path dependency is simply in terms of officials doing what they can imagine. But there's other factors as well, and the one is ideological. Now, what do policy making and implementing elites think should be done? And in Botswana, by and large, most government officials and most ministers and members of parliament from the ruling Botswana Democratic Party believe that giving poor people cash, giving them much cash, is generally not a good idea. It's going to result in problems of dependency, and the poor are going to get lazier than they already are, etc., etc. What you need to do is for the most part to give people food and offer them work opportunities. You don't actually give them cash payments. So this is an ideological position, and that ideological position continues to underpin Botswana's response to COVID. And this is a large factor in why they massively distribute food parcels rather than introducing an emergency cash transfer scheme, right? So the ideology is important. Then, of course, also, interest group politics are important, and electoral politics are important. In Zambia, the government, the current government, the Edgar Lungu's PF, Patriotic Front government, ideologically, and nobody can quite figure out where they stand ideologically. Hangala can help us here. But they clearly understand their electoral interests as lying in buying votes from farmers rather than buying votes from poor people through cash transfers. I think it's fairly clear that the PF government think that putting money into farm subsidies is a much better electoral strategy than putting money into cash transfers. And there's some reason for thinking this is true, that when the government stopped paying cash transfers in 2018, 2019, there wasn't a public outcry, or there wasn't much of a public outcry, which suggests that the political costs were limited. The electoral, those political pressures are important. In South Africa, one reason why a lot of money went into UIF TERS is because business and labour are well organised, and through NEDLAC, they were able to really push the government and in fact to take over much of the actual implementation. The UIF TERS scheme was saved by really business and labour through NEDLAC, and that culminated in last month the entire top leadership of the UIF being suspended for pretty much incompetence. So that if you have powerful business, well-organized business and labor, then you're much more likely, obviously, to get resources being put into programs like unemployment insurance for formally employed workers. It's not surprising that countries which have been under pressure to have agrarian responses in the past continue to be under pressure to have agrarian responses now, and so on. Do you want to come back on that, Anthony? There's a question here which I think for Anthony.
That's great, Jeremy. That's really helpful. Thank you.
There's a question for Lena, I think. Any comments on the adequacy of cash transfers?
Yeah, very, very good question. We did collect basically our benefit values on the COVID response where that was possible. I'm actually still busy kind of evaluating that a little bit, also because it is quite patchy. Generally, we've seen more in terms of horizontal, so coverage expansion rather than increasing benefit values, which makes sense because I mean, many of those who were hit hard by COVID and by lockdowns were those who weren't really formally excluded in existing programs. So if you top up benefit values to pensioners or to child grant beneficiaries, then you're not necessarily reaching informal workers. I mean, sure, in South Africa, that was part of the thought behind it, that if you increase the child support grant, it actually filters through. But to directly target certain beneficiary groups, you had to then go through new enrollment campaigns. Generally speaking, I mean, in sub-Saharan Africa, benefit values have been lower than in other parts of the world. But then, yeah, again, if you compare it to PPP values and so on, income is lower. But yeah, benefits have been small overall in terms of cash transfers. Again, South Africa being one of the most generous countries in terms of the benefit values, which once again, it also compares to pre-COVID situation, where South Africa definitely has one of the more generous benefit levels. And even though the special COVID grant wasn't very large in terms of benefit values, but if you compare it to other African countries, it's actually still kind of up there. Yeah, I mean, we've seen a few countries like Mauritius, but then again, Mauritius quite developed, not really high levels of poverty, relatively small programs, so they had quite generous additional payments. But again, it's, yeah, you can't really compare that to a country like Ethiopia, for example. So yeah, maybe to sum up, your data is still patchy, but there will be data in the big mapping that will be released towards the end of the year. And I'm also busy looking at that for sub-Saharan Africa. But yeah, overall speaking, relatively low benefit values. And also if we look at things like subsidies, I mean, electricity, water subsidies, if you look at the poorest households, they're either already benefiting from reduced tariffs in most of those countries. In some countries, you already have a certain free allocation of water or electricity, or they're not even using the formal water electricity structure. So there's also questions around how much of those subsidies, or the value of those subsidies, how much is it actually worth to the poorest households? So those are other questions as well. And even with the mobile money subsidies, I mean, to what extent does that really help someone if you make mobile money transactions free, if you're not even making use of that? So once again, you have measures that are implemented and that may, have a certain value in theory, but then the actual value of that in practice, depending on how much people use those services, and especially the poorest part of the population uses those services, is a different question altogether.
Yeah, I think just to underscore Lena's point that the technological change has really been quite dramatic, but the technological change and the technological capacity runs ahead of the financial commitments and the political will to actually to use them to roll out programs on a large scale. The technologies now exist for governments to actually do quite a lot quite fast if they want to, and they can allocate the resources, but by and large resources haven't been allocated. South Africa is the obvious exception. By and large, resources haven't been allocated, and still there doesn't appear to be a huge amount of political will to rolling out cash transfers as opposed to farm subsidies and other interventions. I think we're running out of time. Anyone have any final thoughts? Well, thank you very much. The next webinar, the date will be advertised. I'm not sure whether it's, as I said, Nonzuzo or Hangala. We will advertise a date, and I think it's in about 4 weeks' time. Thank you very much for attending. Nice to see you all. Thank you, Armando. I assume you're sitting in England, Armando. Thank you, everyone else.
Yeah, thanks everyone, and goodbye.
Goodbye. And